Good morning, my name is Beatriz Snell and I'm the Phlebotomy Supervisor here at DHR Health Laboratories. This morning we're going to be demonstrating for you a venipuncture collection. So most of you probably have questions. What is a phlebotomist? A phlebotomist is an individual who draws blood. Okay, how do you become a phlebotomist? You do need a certification to become a phlebotomist, and it is an entry-level health profession. Okay, what patients do we see here at the hospital? We see different types of patients, starting with pediatrics, adults, and geriatrics. We also have critical patients here. The duty as a phlebotomist is day to day. They are assigned a tower and they are to go and collect patients every day, room to room. I'm going to go ahead and demonstrate the process that we follow here at the hospital. We do have an order of draw that we must follow every single time. So first of all, we have these bottles here. These are blood cultures. Anytime that a doctor orders blood cultures and a venipuncture collection for any type of testing, we have to follow this certain order of draw. First, we draw our blood cultures, then we draw the blue tube, the red tube, and so on and so forth, just the way you see here. Every tube contains a different additive, and we need to make sure that we collect it in this order of draw. That way we don't contaminate any of the tubes. That is the reason why we follow the order of draw. We have different methods here at the hospital of drawing blood. Our most common is the Vacutainer method, which is what you see here. This is your Vacutainer and this is your needle. Okay, we also have the butterfly method, which is what a lot of patients prefer, just because it's a smaller needle. Okay, and we also have the syringe method. This is your syringe and then this would be your needle. Okay, so this morning what we're going to be doing is we're going to be demonstrating a venipuncture collection. Okay, so the very first thing that you do here at the hospital is, of course, if you're assigned to whatever room to go in and draw that patient, the very first thing that you do, of course, is you knock the door, you identify yourself to the patient and your department as well. So let's go ahead and get started with that process. So, okay, I knocked the door. Okay, can I come in? Okay, my name is Beatriz Snell and I'm here to draw your blood. I'm the phlebotomist, okay? So, you know, you kind of engage a conversation with the patient, you get all your supplies ready, and the very first thing that you do is you either hand sanitize your hands or you wash your hands. Okay, so then after you do that, you don your gloves. Okay. What we're going to do is we're going to use a butterfly, okay, and we're going to go ahead and advise the patient that we're going to be using a smaller needle. I'm going to use a smaller needle, ma'am. Okay, so in this method is the butterfly method, okay, and the butterfly has a different connector. So this is this little hub that you see here that has the blue end. You open it up and you attach it in here. Okay, so let's see. This that we already used goes in your sharps container. Okay, okay, so here we go. Same thing, you go ahead and feel and see where you find your best vein. Okay, go. Make me a fist. Okay. So here we go. Okay, you're going to remove this plastic and there's your needle. Always bevel up. Okay, and here we go. Okay, like so. The cool thing about the butterfly is that once it's inserted in the patient, you don't have to hold it, and as you can see, you already see the flow there, so you know that there's blood coming out. Once you see that there's blood in there, what you do is you stick your tube and you'll see how the blood is flowing and how it's being filled. Okay? So once it stops, what you want to do is you want to make sure that you invert your tube lightly, okay? Because remember, like I said, this has additive, so we want to make sure that we invert it, okay? Now, the next tube, okay, and it's filling up. Okay, it's done. Make sure you invert it a couple of times. Okay, you can open your hand, ma'am. Okay, there you go. You remove your tourniquet. You apply your gauze. You remove the butterfly. Once you remove it, it has a little button up here that you click, and the needle retracts. Okay, you apply pressure. You assess the area to make sure that she's not bleeding. Okay, then you're ready to apply your tape. Okay. All right, so we can apply the tape. Okay, there we go. So this is your venipuncture collection using the butterfly method. Make sure that you discard your sharps in the container. Okay, and make sure that you label your tubes with the patient's information before leaving the room. We go ahead and label it and everything, and it's ready to go to lab for processing. Thank you for tuning in, and this is the way that we do our venipuncture collection here at DHR Health.